Good afternoon. Today we have to perform the musculoskeletal assessment. So, and the musculoskeletal assessment is a very simple exam. So, but we need to look for the general aspect of the patient, looking for deformities, looking for the joints, the range of motion of the joints, I mean, and swelling of the joints, as well as some bone deformities or swelling or malformations that we can find in the assessment. So it's the same, the head-to-toe assessment, but only focusing in the musculoskeletal system. So, and starting by the appearance of the face. So, and it's easy the first time to explore the temporomandibular joint. So, we need to explore by inspecting, palpation, and then for the movement. Okay, so we can continue. So, looking for the range of motion of the spinal spine. So, looking for first inspection, and then for the movement of the cervical spine. So, flexion, extension, lateral movement. So, and now it's something that maybe makes it in the neurological exam, but we can perform here to see the muscular strength from one side, other side, front, and back. Now we can follow with the shoulders. And as I said before, the inspection is the first step. So we need to inspect the patient looking for deformities or masses or any other condition that the patient may have. So, and as well, we need to look for the joint. So we need to after inspection, we can proceed to palpate the structures inside the joint, looking for swelling, tumors, anomalies, and of course then the range of motion of the joint. So it's bilateral, and of course we need to go back to the other different signs. And I said before, first inspection, and then we need to proceed to the palpation, and then to explore the movement of the joint. So can you proceed to see that in that way? Other way? Okay. The other important part of the physical exam is the range of motion of every joint. So, and to explore the range of motion, we can perform different maneuvers, but and it's better to some exercises that are better, including for the range of motion, also the muscular strength at the same time, in order to make it easier and shorter the exam. So can you do it like this? So, and you press down, you press up. Okay, now strain your muscles. Okay, up, down. Okay, that's good. Because the patient has a normal range of motion, he can go. Okay, open down. Okay, when the patient has no swellings, no pain. No, we can proceed down. So looking for the elbows. So, and of course the same organ inspections first, and then looking for deformities on nodules, something or anomalies in the elbows and every joint, and of course the range of motion. The palpation of the structure of the every joint is very important. So we need to palpate the joint, elbows, wrist. In the case of wrist, it's very important to note the hand. So because we need to keep in consideration that the patient with some diseases like a carpal tunnel syndrome maybe has atrophy of the thenar eminence in the hand. So that's why the inspection is so important. Then we can proceed to the fingers in order to look for nodules, swellings, in special some deformities like swangans and all that appear in the rheumatoid arthritis. After they perform, remember the exam is bilateral. After they perform the other side, so we can proceed to explore the limbs. So of course, and I said before, starting for inspection of the patient. So in that case, we start to explore the knees. So we can palpate the structure of the joints. Okay. The ankles. And now we're looking for movements and muscular strength. Can you push up? Okay, now okay, and then the ankles, the muscular strength, and up. Okay. Now we can proceed to the exam of the both hips. Okay. For the hip exam, as always, we need to start for inspection of the patient and symmetrically or bilaterally. Okay. Then we can proceed for palpation of the structure of the hip. So, of course, looking for the same that I said before, anomalies, masses, deformities, and something else. Okay. We can proceed to examine the range of motion of the hip. So, we need to explore flexion and that way in the range of motion, and of course bilateral. We also can explore at this time the muscular strength of the hips. So in that way we can go down, now up, okay, and of course of the other side. So now we are going to explore the spine. So, and this is very important part of the exam. We are looking for deformities. Sometimes it's very apparent, and sometimes not. So we are going to look for symmetry, for the symmetry of the spine. Now we are going to flex the patient and to explore the shoulders, looking for any old elevation seen one from another, and then we need to looking for symmetry or alterations that can produce scoliosis. My name is Alfredo Lau, and in this way we finish the musculoskeletal exam. Thank you.
Good afternoon. My name is Sama Fombo. I'm going to be assessing the musculoskeletal. I'm going to do a head-to-toe assessment. I'm going to check for deformities. I'm going to check for abnormalities. I'm going to start by examining from the head. I'm going to ask the patient to open and close his mouth. Open, close. I'm going to ask him to rotate his head back and forth. I'm going to check for symmetry of the shoulders. Okay. I'm going to check the temporal mandibular. Open, close. I'm going to check his neck for symmetry. I'm going to ask him to rotate back and forth. I'm going to check the shoulders for symmetry and asymmetry, back and forth. The neck, I'm going to check the neck, front, backwards, sideways, the other side. Okay, I'm going to go to the back as well and check for any abnormalities. I'm going to check range of motion, which is a very, very important part of the musculoskeletal assessment. I'm going to ask the patient to raise his hands, down, open, close. I'm going to push up, push down. I'm going to ask him to do this. Points for any abnormalities and for any pain. I'm going to check the wrist, the fingers, any abnormalities, any deformities, both bilateral. I'm going to check for the muscular strength, palpate the knee, which is the biggest joint, for any abnormalities, any pain. I'm going to ask the patient to flex. I'm going to ask to push. Okay, I'm going to check the ankle for any deformities, any swellings, any pain, any movement. I'm going to ask him to push up and then down. Flex your toes. Of course, for bilateral, both sides, for any abnormalities. Of course, for symmetry. Okay, I'm going to check. I'm going to do the same exam for both sides of the hip. Assess the spine. I'm going to, for any asymmetry, I'm going to ask the patient to bend down and touch his toes while I check for any abnormalities. Push back, sit up. And my name is Sama Fombo, and this is a brief assessment of the musculoskeletal system.
Good afternoon, my name is Armando Martin, and today we are going to show you the physical assessment of the lymphatic system. We have to begin with the observation of the skin, because the color of the skin is related with some disease of the lymphatic system. We are going to explore looking for occipital nodules. We have to explore with the second, third, and fourth fingers in a circular motion, trying to looking for masses, tenderness, pain. It would be in a circular motion. After the occipital, let's continue with the preauricular ganglion. It's located in the anterior region of the auricular pavilion. We have to explore with two fingers in a circular motions, looking for tenderness, pains or nodules. Then we can continue with the posterior nodules, that it's located in the posterior part of the auricular pavilion, and we have to look for nodules and tenderness or pain. Continue with the superficial anterior, cervical anterior chain, and it's located anterior to the sternocleidomastoid muscle, and we have to search in the same way that as I mentioned before. Then we can continue with the submandibular ganglions, and we have to search in the submandibular regions, and we have to explore below the chin, looking for nodules, tenderness, and this assessment could be performed in front of the patients or behind the patients. If we use our both hands, we can explore this region and this region with the other hands in behind the patient. We can continue with the supraclavicular, and we will begin with the upper part, searching, looking for ganglions in the supraclavicular regions, especially in the left supraclavicular region. That there is a ganglion that is named Virchow ganglion, that it's present when there are some neoplastic lesions in the thorax or in the abdomen. Then we can continue exploring the axillary ganglion. And it should be performed in both parts, but we order the patient, we ask the patient to put their hands in the head, and we explore the region, looking for superficially and more deeper, trying to find any mass of tenderness. You feel hurt? No? That's normal. Then we can continue exploring the trochlear, epitrochlear a ganglion that it's located in the at the level of the epitrochlear regions, and it's normal. With the inguinal region, and for perform this assessment, we can do it with the patient in a stand position or in a lying position. We are going to put the patient in a lying position. We have to explore looking for mass first. We have to explore visually if there are any increase in volume, and after that we have to explore the inguinal region looking for any mass, tenderness, or pain. We begin superficially and then continue more deeper. Then we can go to the popliteal region and explore in the popliteal area looking for mass, nodules, tenderness. As part of the lymphatic system assessment, we have to include the assessment of the skin, and we have to look for edema. Edema with the characteristic of the lymphatic edema. We are looking for edema in the extremity. It's important to know if the edema is unilateral or if it is bilateral. We found, especially in women, edema in the mammary areas that are related with the obstruction of the lymphatic system when there are malignant disease of the breast. We have to explore the spleen. As the spleen is located in the abdomen, we are going to follow the steps as must be followed when we examine the abdomen. The first thing that we are going to do is auscultate the abdomen, specifically the spleen, looking for fluid and murmurs. What is expected is that there are no fluid or murmurs. Next, we have to palpate the spleen. What we are looking is for enlargement of the spleen. Normally, the spleen shouldn't be palpated below the external costal border, the substernal costal border. We have to begin far of the spleen because if we begin the exploration near the spleen and the patient has a splenomegaly, we can miss it. And what is recommended is begin far the spleen, maintain our hands in a stable position, and ask the patient to take a deep breath. Take a deep breath. And we can change the hand position during the breath out of the patient. Take a deep breath. Take a deep breath. Take a deep breath. Okay. It's normal not found any mass touching our fingers. We continue with the percussion. Normally, it should not be percuted. It should not be dull. If we find dullness during percussion in the spleen area, it should mean that the spleen is enlarged. And in this way, we finish the physical assessment of the lymphatic system. My name is Armando Martin, and have a nice day.
Hello, good afternoon. My name is Alexander Cabrera, and I'm going to explain the physical assessment of the lymphatic system. I'm going to start the physical assessment of the lymphatic system, with inspection of the skin of the patient. We can find different change in the skin color in some disease related with the lymphatic and immunological system. After that, I'm going to start the examination with the palpation and inspection of the areas when we can find lymphatic node change, the most important lymphatic node change, And starting in the head, we are looking in the occipital area. In the base of the skull, we have to palpate with 3 fingers in a very, circular motions with slight pressure and then increasing the pressure. We have to find if there is any lymphatic node, if there is swelling or tenderness in the area. Do you feel pain?
No.
We have to check in both area of the base of the skull. After that, we're gonna check the other areas in the head when we can find lymphatic nodes. For example, in the preauricular area, we have to use 2 fingers to palpate any lymphatic nodes. Lymphatic nodes, we should not feel a very evident lymphatic node. They have to be mobile. There is no pain in a normal lymphatic node, so they should not be fixed in the area. So we have to check the preauricular area, and we are going to check the post-auricular area, looking for lymphatic nodes. Then we have to do it in both eyes, of course. Then we are going to check the parotid area, which is in the angle of the mandible. We have to check with 2 or 3 fingers. We have to check for lymphatic nodes. Then in the middle part, in the way from the parotid area to the chin, we have to check in the lateral region behind the mandible if we find a lymphatic node. In the other side of the head, of course, we have to do the same. And in the front of the head and below the chin, we have to palpate for looking for lymphatic nodes if there is swelling or there are pain or tenderness in this area. After that, I'm gonna check the area related with the neck. We have to make the inspection of the neck in the anterior region, because sometimes when a lymph node is swelling or is in a big proportion, we can see it directly looking into the skin. I'm gonna check the superficial anterior cervical area for superficial anterior lymphatic node chain and the superficial posterior lymphatic node chain of the neck in both eyes, for example. Be careful, we are palpating near the carotid artery, so we have to be very kind to avoid any problems or symptoms with the patient. When we finish with the neck area, we are going to examine the supraclavicular area, which is a very important part of the physical assessment of lymphatic system, because this is an area that sometimes when we find lymph nodes in that area, it could be a manifestation of malignancy, and we are going to examine the supraclavicular area in both sides, of course, looking for any swelling, tenderness, or a palpable lymph node. Both sides. After that, we're gonna check the axillary region we are gonna ask the patient to put the hand in the head, and we are gonna palpate the axillary region, looking for lymph node change in the area if there is any swelling or tenderness at the same way. We have to do it to the other axillary region too, and we are gonna look for any lymphatic node. Using the same position, we're gonna check the epitrochlear region, looking for any lymphatic node. The same thing with the other part with the other extremity. I'm gonna ask the patient to lie down in the bed to examine the inguinal area. Okay, in the inguinal area, we are gonna check the superficial superior and superficial inferior inguinal lymphatic chain, looking for any lymphatic node. If there is swelling, tenderness, we have to check if there is any lymphatic node fixed in the area, which is an important sign of an important disease, of course. I have to do it in both eyes, of course. After that, I'm gonna check the popliteal area, looking for lymphatic nodes in the popliteal area, and of course, if we find any node, we have to check the consistency, how big it is, if the node is fixed or is mobile, and if there is swelling or tenderness related with the lymphatic node. It is important to know that when we are assessing the lymphatic system, we have to check in the extremity for the presence of edema. We have to check if there is any edema, about the characteristic of the edema, if it's bilateral edema or if it's unilateral edema, and you know, the magnitude of the edema, because sometimes edema is an expression of lymphatic node inflammation in the abdomen or in different chains. We can cause the obstruction of the lymphatic circulation and provoke the edema in the extremity, so we have to check for edema. And as part of the lymphatic system assessment, we have to check in the abdomen the presence of enlargement of the spleen and enlargement of the liver, which can be affected if we have a disease related with the lymphatic and immunologic system. As we know, to check the abdomen, we have to follow the different steps of the abdominal examination, which are inspection, auscultation, palpation, and percussion. And in the inspection, we have to see the symmetry of the abdomen, if there is any swelling, or if there is any mass that we can see directly in the inspection of the abdomen. We're gonna auscultate the abdomen, looking for any root or murmur in the region where the spleen is located. And after that, we're gonna make the palpation, looking for enlargement of the spleen or enlargement of the liver. We are gonna do it gently. To look for the enlargement of the spleen, we are gonna start palpating in the right lower quadrant, and we are going up direct through the spleen region. We can ask the patient to breathe in and breathe out, and then if there are any enlargement of the spleen, we're gonna feel in the tip of our fingers that when this movement, this respiratory movement, we're gonna find that the organ is enlarged, because we're gonna feel it with our fingers. Of course, we are gonna check. There are different maneuvers to check if there is any enlargement of the liver, and if there is any enlargement, we have to measure how many centimeters is the liver below the costal margin. And after that, we can make the percussion. In the percussion, we are going to define. We are going to define if there is an enlargement too, because normally we can percuss very easily the spleen. We are going to find normally a tympanic sound in this area, but if the spleen or the liver, if they are, if they are with some kind of inflammation, we're going to feel a dullness sound in this area. Basically, this is the most important part of the lymphatic system assessment. My name is Alexander Cabrera